Hello, welcome back. I'm so glad you're here. I know everybody's busy in dentistry, and this podcast has really been taking off. And so I want to really thank you from the bottom of my heart for being here. I think the dentists, the dental professionals, the people in the industry that show up to listen to this podcast every week are the engaged people that are really moving this industry forward. And I think it's vitally important. Even if you're a patient, who I know that we have some patients that listen in, welcome, welcome. I think that obviously it's called the Patient First podcast because we really want to focus on the ultimately helping patients in dentistry get access to care and get the care that they deserve, and having dental practices, frankly, dentists to be as profitable as they should be so that they can ultimately help patients more. I think it's all vitally important. And I start off today like that because I did have an interaction at a recent trade show that I wanted to talk about. So I went to the SmileCon, the ADA dental meeting, which was great in Houston, Texas, not that long ago. And first, I was at 3 days of ADA standard committee meetings, which are fantastic. Again, I love doing work in standards regarding standards within the dental industry. I think that standards are key to helping remove the barriers for innovation, for helping patients get access to care, for making dentistry more convenient and aligned to help people. So get involved with standards. That's my quick pitch. If you need to know more, like, subscribe, comment, reach out to me. If you're interested in getting involved with standards, I'd love to talk with you. But anyway, I digress because this isn't about that part of the meeting. What I wanted to talk about was I went to my alma mater, threw together a happy hour, like a little get together for people who went to the University of Minnesota where I went, and it was nice. It was got to meet some people and meet some people that I've reconnect with some people that I haven't met in a while, but I got to meet 3 relatively new dentists. So they just graduated a couple years ago, and at the end of this get together, we connected, and they were asking me about where my practice is, and we got to talking. I was asking them about their careers, and it came out that now I am not seeing patients on a regularly scheduled basis. So I'm here talking with you today. If you know anything about my career, I do a lot in technology and dentistry and help other companies in dentistry, and I don't have the capacity to see regularly scheduled patients anymore. And I brought this up, and I said, well, my practice that I'm part of is in Wayzata, Minnesota, but I don't see patients, and I'm not there very much anymore because I'm running technology companies and educational platforms, Upgrade Dental, Tooth Apps, and the other companies that I'm part of, but primarily Tooth Apps and Upgrade Dental, out of a new office that I have because the practice has grown so much. And these dentists looked at me and they said to me, which didn't strike me until after our interaction. They all 3 said, boy, we'd love to not see patients anymore. How did you make that happen? And I was like, well, I told them the path that I've been on for the last over 20 years. Started off in technology, training dentists, and then decided to create my own. And it's kind of just been ballooning up. And here I am today, not seeing patients on a regular basis. And then they said, well, how did you do that? And I gave them some tips. One of them had an idea, and I talked to them about how to implement technology, or how to take an idea and turn it into a go-to-market product, and how some ideas that I had around that. And after I left, I kind of realized it was a sad interaction in retrospect, because frankly, I loved seeing patients. I love dentistry. I think it's a phenomenal career. I had an entire career of seeing patients, and I still do see patients occasionally, but I don't anymore because I'm doing other things that I also love to do. And as much as I think I'm a very good dentist, and I think I deliver great care, the other dentists who took over the practice do phenomenal care too. And my unique skill set in dentistry, I believe, lends itself more to technology and to doing things like this. Thank you again for being here, talking to dental professionals and dental patients and industry partners. And so I just have other things that I'm focusing on, which has nothing to do with not loving the actual delivery of care, which these three dentists who are 2 years out were thinking about how do we hang up the handpiece. And it's a little sad to me. And I wish I could go back and ask them why, because I think back to when I was 2 years out of dental school, and it's stressful. I mean, dentistry, particularly early in your career, is stressful. But I never had the thought I want to move on to something else. And if I did, because of, there's quite a bit more of that talk in the industry right now. Like, if you don't want to be if you don't want to be in the operatory seeing patients, there's this other pathway. I think to the younger dentists out there, stick it out for a bit. I mean, you really want to get excellent at delivering care before you would ever think about doing anything else. I think, I do know some people that, are entrepreneurs in dentistry and haven't seen patients, but and they're phenomenal people, do great things. But I think it is really nice to have that background of really delivering care at an incredibly high level so that you can speak to dentists at not just as another dentist who's went through dental school, but from a place of knowledge of knowing what it takes to be a dentist. Now, maybe you get that experience in 2 years, maybe it takes you 10, but I think it was a little bit sad to me to realize that these people already have on their minds leaving dentistry completely. I don't know why, but I think I do know why, because I've been reflecting on it a little bit, and I was thinking about why is this sad to me, and I think it's because there's reasons why I became a dentist. The reasons why I became a dentist primarily are to help people and to work with my hands, and it's a great career, frankly. And so I'll talk about each three of those a little bit. Helping people in dentistry. What I love about delivering dental care is that person in your chair you are helping every single day. Whether or not they see it is one thing, and I think people have kind of lost their minds a little bit going through this whole pandemic, and hopefully that things are going to be balancing out a little bit on the patient's mindset around the care that you deliver. But there wasn't a day that went by in my dental practice where patients didn't give me a heartfelt thanks, truly appreciative of what I did. Not everybody, but every day, certainly. And most patients, frankly, were very, very appreciative of the work that we provided because we did it at a high level. We did it with compassion. And I think at a high, and so people were very appreciative. And that's great to do every day. Now, I believe that the work that I'm doing now, I can help more people have greater impact, which makes it even more fun for me. But when you're just starting out in dentistry, that's hard to see that path. That if you're seeing patients every single day, delivering high quality care, if you did go into dentistry to help people, which I don't know why you would go into dentistry if you didn't want to help people, but that's another topic. I think that dentistry is a great career. It's a fulfilling career because you do get to help people every single day. And you do that through, under point number 2, you get to create art while helping people. And that's such a beautiful thing. Dentistry is such a good merger of art and science and helping people all in one. It's such a phenomenal career from that perspective. Now I'm a little older, so as I got older, my hands actually started to hurt a bit. So not working with my hands now too actually helps my overall health. But that's mainly because I have some pre-existing conditions. I have a severed nerve in my right shoulder from when I was young. And also because, frankly, I think I just had poor ergonomics my entire career. So if you are younger, I would definitely recommend getting educated on having and leveraging good ergonomics. But I think working with your hands, creating art while also, you're an engineer, you're an artist, and a psychiatrist, basically. It's a great mix of attributes that all come together to help people. So to the younger dentists or the dentists that are thinking about that are looking outside of dentistry, I would really have you take another great look at your career to say how truly good it is. Getting down to that last point, being a great career, I think that in dentistry, we go into it sometimes thinking that, well, you don't work as many hours as a dentist. So that makes, basically you get paid well. less hours than other careers. And those things are also very true. So this podcast, I really want to have be a little bit of a love letter to the practicing of dentistry, which I don't do very much anymore, based on the conversation that I had with those three newer dentists in their careers, that if you're only a couple years in, I would recommend trying, refocusing and really focusing on becoming absolutely excellent at delivering care and enjoying the process, because I think that the grass is always greener on the other side, right? Cliches are cliche for a reason. And I wish I would have presented that answer to those dentists when I was out in Houston at the ADA SmileCon meeting. And but so because I wish I had given them that answer versus what I did, which was giving them a pathway to help them develop technology, I would definitely recommend, if getting out and doing another career is incredibly hard, and being a dentist is a fantastic career. And there's always bumps in it. There's negative aspects of every career. I absolutely loved seeing patients, and it was an honor, and is when I see them today. And I would hopefully think that you view it that way too. Let me know your thoughts. If you're a dentist today and you're at the end of your career, or if you're at the beginning of your career, or you're stuck in the middle going, you have either positive or negative thoughts about being a healthcare professional, being a dental professional, whether you're a hygienist, an assistant, or a dentist. What are your thoughts on delivering care today? Because it really got me thinking about, I wouldn't say that I necessarily miss being a dentist every day, because I have so many other great things that I get to do. However, I also never really never really thought that it would be my path to be doing something as sort of a second career, which it has become, which is fantastic in its own right. But I also love being a dentist every day. So let me know your thoughts, like, comment, subscribe, and I look forward to seeing you next week at the Patient First Podcast. Thank you.